Assalamu alaikum. My name is Dr. Ambar Arshad, and today my topic of presentation is trichomoniasis. Bismillahirrahmanirrahim. If people are doubting how far you can go, go so far that you can't hear them anymore. Learning outlines. We will discuss in this presentation introduction, epidemiological factors, chain of transmission, clinical manifestations, levels of prevention, and recent advances. At the end of the presentation, students will be able to describe the epidemiological aspects of trichomoniasis, preventive aspects of trichomoniasis, national and global updates, and recent advances. Trichomoniasis or trich is a very common sexually transmitted disease. It is caused by infection with protozoan parasite called Trichomonas vaginalis. Although symptoms of this disease varies, most of the people who have the parasite cannot tell they are infected. Usually have mild symptoms. Trichomoniasis is the most common curable STD. According to CDC, it has been estimated that in United States in the year 2018, more than 2 million people were infected with trichomoniasis infection. The prevalence of trichomoniasis infection varies from 5% in patients at hospitals to 75% in sexual workers. However, only about 30% develop any symptoms of trichomoniasis. High prevalence has also been seen in South Africa among pregnant women, which is up to 65%. And the condition is also prevalent in Europe, other than USA and other developed countries. As a part of the whole, according to WHO, the sexually transmitted infections in year 2018 were up to 26 million. And half of these new STIs were among young youth, 15 to 24 years in US. And total nearly 68 million infections were documented in 2018, and 1 in 5 people were having STIs. From the year 2013 to 2016, the people that were mostly affected were between age 14 to 59 years. Among them were males that were only 0.5%, and females were more affected than males that made up to 2.1%. And highest prevalence were observed among non-Hispanic black males and females, 9.6%. These are the cases from 2000 to 2016, and they ranged between 2 lakhs. And in 2016, the total cases of Trichomonas vaginalis infection in United States were 2,22,000. The epidemiological triad include agent, host, and the environment. The agent responsible for trichomoniasis infection is a flagellate, that is Trichomonas vaginalis, and the most common pathogenic protozoan for humans in industrialized countries. It is a pear-shaped protozoan with flagella. And Trichomonas vaginalis human is the only host, and usually it causes urinary tract infections. Females are more affected than males, and the age that is most susceptible to this infection is 14 to 49 years. People with more sexual partners are more likely to be infected, and other risk factors include limited education and low socioeconomic status. The environmental factors include seasonal variability, and almost every continent is infected, is having these trichomonal infections. The habitat in which the vaginalis trophozoite lives in females, it's mostly the vagina, and the urethra in males, it's the urethra. Normally, it is believed that Trichomonas vaginalis is a sexually transmitted disease, but extensive literature showed that non-sexual transmission can also occur through fomites, towels, toilet seats, and from swimming pools. Since trophozoites cannot survive outside, so infection must be transmitted directly from person to person. And the usual mode, as I have mentioned earlier, is sexual transmission, through sexual transmission. Trichomonas often coexist with other sexually transmitted diseases like candidiasis, gonorrhea, syphilis, and HIV. Babies can get infected during birth, but the incidence of deaths and missed abortions of the fetus is less. Fomites such as towels have been implicated in transmission, and trophozoites that are responsible for the transmission divides by binary fission. The incubation period for Trichomonas vaginalis infection ranges between 5 to 28 days. Among those people who develop symptoms, but others do not develop symptoms until much later. Symptoms can come and go and without treatment, and the infection can last for months or even years. In women, uh, usually the women are having more symptoms and have severe infections as compared to males. In symptomatic females, the common symptoms are profuse odorous discharge, burning, itching, dyspareunia, frequency of urination, and dysuria. And on examination, we see excessive vaginal discharge, diffuse vulval erythema, and vaginal wall inflammation, and we also call it as strawberry cervix. Males are frequently asymptomatic, and symptoms only appear when the prostate or the higher parts of the urogenital tract gets infected. On examination, we usually observe enlarged tender prostate and epididymitis. About 70% of the infected people do not have any signs and symptoms. And as mentioned earlier, the incubation period is between 5 to 28 days among people who have symptoms. Here is a chart showing the common symptoms among females on the left side and males on the right side. Yellowish vaginal discharge with vaginal bleeding and frequent urge of urinate and pain during intercourse among females. And among males, there is discharge from urethra, burning during urination, after ejaculation, and urge to urinate frequently. Trichomonas can increase the risk of getting and spreading other sexually transmitted infections. For example, trichomoniasis can cause genital inflammation that makes it easier to get infected with HIV or to pass the HIV virus onto the other partner. Trichomoniasis affect a pregnant woman and baby, but in pregnant women are more likely to have their babies either there is preterm babies or the babies are low birth weight babies. Morbidity is low and the chances of missed abortions is less as compared to other STIs in trichomoniasis. Now the levels of prevention. Primary prevention. We educate people to have safe sexual behaviors, avoidance of multiple sex partners, use of barrier methods to prevent the transmission of infection, and detection and treatment of cases, either males or females. So we use this criteria to prevent the transmission of the protozoa or the infection. Use barrier methods, get tested, be sure you and your partner are tested for STIs, be monogamous, limit your sexual partners, and don't abuse alcohols and drugs. Now for the vaccine. Only a single killed vaccine is available in the market, only in the developed countries, and it's only used for animals. How this vaccine is used for animals is that 2 ml dose is subcutaneously given in the neck or behind the shoulder. Second dose should be administered 2 to 4 weeks later. And the annual booster vaccination is a single dose that precedes the breeding season by not less than 4 weeks. And no vaccine for humans has been developed yet. it's still under research, and studies are being conducted to develop a killed vaccine that can prevent this infection among humans. For the diagnosis, it is not possible to diagnose trichomoniasis based on symptoms alone. So, for both men and women, a healthcare provider should examine and get laboratory tests to diagnose trichomoniasis. The lab tests that are commonly done for the diagnosis are screening and diagnosis are microscopy, culture, antigen detection in vaginal smears, molecular diagnosis, and other tests. Specimens that are preferred in women are vaginal discharge and endocervical specimens. And in men, prostatic fluid, less commonly semen. But common specimens are urethral swabs, early morning, first word urine sediment. In microscopy, we use wet mount, acridine orange staining, direct fluorescent antibody staining, and pap smears. Vaginal or urethral discharge is examined microscopically in a saline wet mount preparation for characteristic jerky, twitching, motility, and shape. And fixed smears may be stained with acridine orange, and DFA is more sensitive. Culture is currently considered as gold standard for the diagnosis, and it is recommended that direct microscopy is negative and considered as a gold standard as well as the most sensitive method for diagnosis of infection. But there are more tests that are more, but there are other tests that are more sensitive. But in countries where there is trichomoniasis and they cannot afford expensive tests like PCR and other expensive tests, ELISA, so the culture is considered as gold standard for diagnosis as it is economical and less time consuming. Antigen detection in vaginal smears is also used through ELISA, and molecular diagnosis, the nucleic acid amplification test on the vaginal swab, is used nowadays, and this is the most sensitive and specific test for screening and diagnosis of Trichomonas vaginalis in the developed countries. And PCR is highly sensitive and specific test for diagnosis of Trichomonas vaginalis with having 97% sensitivity and specificity. And the preferred test for molecular diagnosis nowadays is NAT testing. For the treatment of trichomonas infection, we use medications like metronidazole and tinidazole. These pills are taken by mouth, and it is also safe medication during pregnancy. And it is not recommended to drink alcohol with 24 hours after taking medication. People are not totally immune after getting the trichomonas infection, and reinfections can occur. So to avoid these reinfections, all sexual partners should get treated with antibiotics at the same time and get checked at 3 months to make sure that the infection has not grown again. Recently, a drug-resistant strains for trichomonas has been reported in several countries, and the main treatment against this disease is metronidazole and some other nitronidazole derivatives. However, between 5 to 20%, the main treatment against normal trichomonas infection is metronidazole and nitronidazole derivatives. However, between 5 to 20% of clinical cases are caused by parasite resistant to these drugs. So for these resistant strains, alternative treatment options are available with high-dose tinidazole, intravaginal paramomycin cream combinations with intravaginal boric acid and intravaginal metrazole miconazoles. And high-dose regimen of metronidazole and tinidazole are also recommended. Further studies are needed to further examine the mechanisms by which resistance develops and new treatment regimes that can overcome it. Now the recent advances. This growing epidemic of STS infection in adolescent is a problem nowadays, and this STIs include the trichomoniasis infection along with other STIs, and the age that is more affected is between 15 to 24 years of age. And STIs rates in adolescents have been rising since 2014. Barriers to STI screening for adolescents include confidentiality concerns and lack of access to health care. So prevention through STI vaccines, represents a promising way to combat this epidemic. And STIs, since STIs are a growing concern for adolescents, so proper screening and management are of critical importance. This is a study that was conducted in Quetta, Balochistan, Pakistan, and uh, some of the cases were also detected, but the overall incidence of these Trichomonas vaginalis infections is low in Pakistan. Out of total 600 samples that were tested for Trichomonas vaginalis infection, only 1% males and only 1% males were found positive. 1% females were found positives, and no male was detected positive for trichomonas, and overall percentage in total samples was found to be 0.5%, that is relatively low. And metronidazole, there is an antimicrobial susceptibility against metronidazole and carbapenem in clinical anaerobe isolates from Pakistan. So metronidazole is an important first line drug for this infection. Combined resistance to metronidazole carbapenem hampers the treatment and is associated with poorer outcomes if present. But in Pakistan, this paper was published in 2019 that reported that 17.5% resistance among anaerobe against metronidazole is observed in Pakistan. Now it's time for the MCQs. A 28-year-old African American woman comes into a sexually transmitted disease clinic with her boyfriend to get an HIV test and to get screened for any sexually transmitted infections. She has a history of several STDs in past. The routine screening ordered for this woman includes screening for trichomonas. Which one of the following would you recommend as a preferred screening test? Wet mount, NAT, culture. Yes, NAT is the yes, B is the correct answer because NAT testing is most sensitive for both screening and diagnostic purposes and is preferred test in the developed countries. Second, a 39-year-old woman presents to a clinic with 5-day history of abnormally increased and slightly malodorous vaginal discharge. And vaginal swabs are sent for nucleic acid amplification testing. Transmitted infections, and these are negative for chlamydia and Neisseria gonorrhea, but positive for Trichomonas vaginalis. Which one of the following represents the best? Metronidazole 2 gram orally in a single dose is a right answer because if metronidazole 500 milligram twice day is also a preferred regime, but for the compliance, the single dose regime is preferred in symptomatic women. So A is the correct answer. A 24-year-old woman recently diagnosed with HIV infection presents for her initial visit. She is feeling well and without any specific complaints at today's visit. As a part of her visit, you are planning to do routine screening for STIs. Which one of the following is true regarding Trichomonas vaginalis infection? D. The correct answer is C, because trichomonas is associated with an increased incidence of pelvic inflammatory diseases, increased and enhanced HIV shedding. The last one answer is not correct because we cannot treat women with HIV as similarly as the women without HIV because a double dose regime is recommended in women with HIV. So C is the correct answer. A 19-year-old man returns home after his first semester at college. He is anxious about STIs and has made to perform testing for chlamydia and Neisseria. He mentions that he has read about trichomonas on internet and asked whether he could be tested. So which is one of the following is recommended? Urethral swab, urine, uric acid. The correct answer is not A, because in men, asymptomatic men, there is no need to be tested screening because usually the males have asymptomatic infections that by time, and since he is not having any symptoms, The male gets symptoms when prostate and the upper urethra is affected. So in this case, when he is not having any kind of symptoms and he is just inquiring, so no screening testing is required in asymptomatic men for Trichomonas vaginalis infection. What species of protozoa causes a foul-smelling vaginal discharge with itching, burning on physical examination of very red surface?
C.
Yes. Trichomoniasis is the answer because of this specific appearance of the cervix. A young woman goes to her doctor with a variety of medical complaints and her mucosal surfaces are tender and inflamed, and laboratory reports the isolation of pear-shaped protozoan. So the organism is observed in which of the following?
E.
Yes, the vaginal secretions are the most preferred specimen in women. So E is the answer. A 25-year-old woman at 20 weeks of gestation is told that her infection can cause preterm birth but has very little other effect on the baby. What is the single most likely infection on baby? Yes, because remaining options, there is a chance of congenital infections and congenital morbidities, but in trichomoniasis, the chances are very low. So E is the answer. Which statement about trichomoniasis is true? It is a sexually transmitted disease.
A.
It is incurable. Yes. The answer is A, and I will also explain the remaining options because it is curable. Men are mostly asymptomatic, and usually there is contact when the surfaces are wet and contaminated with the infection. And pregnant women with infected less likely to report spontaneous abortions. They usually report low birth weight babies and uh, preterm babies. Last one, which is the gold standard technique for diagnosis of Trichomonas vaginalis in infected patient.
B. Culture.
I've already explained it. The incubation period for Trichomonas
C.
is 5 to 28 days in this case. So this is the key. These are the references, and thank you.
Thank you very much. Wonderful presentation. Especially, I'm so glad that you have presented the MCQs and answered all those different type. And this is brilliant that you have explained even the incorrect answer, that why it is incorrect. So I am really happy, and I want each and every candidate to present like this, that we should also tell the wrong answers, why they are wrong. And most of my questions has been answered. I want to ask about the gold standard, and you have already presented it. It is culture. But I want to know, when we have the PCR test available, and we also have the culture available, then what should be the gold standard then, and why
Uh,
it is still the culture?
Ma'am, as I have already mentioned that if the microscopy test is negative, then the most sensitive and the specific test for diagnosis is PCR because of its high sensitivity and specificity. But if on microscopy we detect the protozoas, that is, then the culture is considered as gold standard. But recent studies have shown that culture has now been on the second and third number, but PCR and NAT testing is more above on the list. But only in certain circumstances where the microscopy is negative, then the PCR and is preferred more. Otherwise, since still culture is considered gold standard.
Very nice elaboration of this fact. However, there is another very important thing that has to be considered, that PCR even give the results positive, even if there are dead organisms that are present inside the human body. So the culture, it only grows the organism in certain medium when it is alive. We are more concerned with the alive type of the organism rather than we are to the dead organism. Even we have seen, even after the successful treatment, after many days, still the people are having positive tests, even if they don't have the disease. In all these cases, culture is having more clinical as well as the prognostic value rather than having PCR. In certain other diseases where there is a very high mortality that is associated with them, we even want to know about the organism that are dead and they are present inside the body because they are still there. But the diseases where the mortality is lesser, we are more concerned with the live organism that are present in the human body. Another very important point that you have mentioned about the flagell or metronidazole resistance, how that issue should be taken up and what are the different preventive strategies, especially in the regard of antibiotics stewardship, as well as different types of the options that are available if antibiotic resistance has been reported.
Ma'am, in case of antibiotic resistance, several trials are being under consideration where inhibitory compounds for protein triisophosphatase isomerases are being considered, but in still the mainline treatment is metronidazole and tenelidozoles in high doses, along with the high dose tenelidozzole intravaginal creams with intravaginal boric acids and intravaginal metronidazoles and miconazoles that have promising results. But antibiotics that are but the resistant strains for the antibiotics for the resistant strain is still being under study, and I was unable to find a specific paper that clearly mentioned the antibiotics. I was unable to find it. So I know only about this about the resistant one. Thank you.
Thank you very much. That is something that we have to be very much concerned because antibiotic stewardship, we always have to prescribe the antibiotics after the cultural sensitivity report. As you have said that the culture is the gold standard, especially when the trichomoniasis is visible under the microscope. The next important step is to find out the culture and to find out the culture and sensitivity report and all the antibiotics that should be given in trichomoniasis. It should be after culture and sensitivity report because we already know that metronidazole resistance has been reported from Pakistan and it is increasing day by day. So we should be only prescribing any important antibiotic, especially for secondary prevention after cultural sensitivity report. Another important thing is there is a very important role of antibiotics in the prevention of trichomoniasis. And if there is a person, his partner or her partner can be saved by giving a successful treatment to the person who has been identified on culture and should be given according to the cultural sensitivity report. This is all from my side. If you have any questions, please do ask.
Thank you.
Okay, Allah Hafiz. Thank you very much.
Allah Hafiz.